Hello, I'm Nick the nurse. Today we're going to be talking about mental health nursing. Specifically, we're going to be talking about the ability to cope and defense mechanisms. When somebody is met with a mental health crisis, where there's some type of external stimuli that causes a person to suffer from stress, we as human beings and our patients tend to put up defense mechanisms as a way to help cope with the external stimuli. One of the defense mechanisms that is commonly discussed both on the NCLEX and is something that you're going to see in your nursing practice is the defense mechanism of denial. Now, denial, contrary to popular belief, is not just a river in Egypt. Denial is a defense mechanism that we as human beings put up and have in our conscious, which allows us to not deal with the problems that are going on. For example, let's say that you had a patient who was seen in the emergency room, and the patient's in the ER and you're the ER nurse, and the patient has an elevated troponin, right, which is a cardiac enzyme that's increased after an MI or heart attack. The patient has an abnormal EKG, LDL and regular total cholesterol levels are through the roof. It's having chest pain, irregular heart rhythms, and arrhythmias. But the patient doesn't think that they have anything cardiac wrong with them, despite the fact that they have all of these different things going on that really clearly suggest that the patient's having a heart attack. So if it's too much for the patient to deal with, the patient can't psychologically or mental health wise cope with the situation, what they're going to do is they're going to use the defense mechanism of denial. And what denial will do is it will allow the patient to consciously or subconsciously not deal with the problem that is being presented to them. Denial is not always the best way to go. It is obviously included in the Kubler-Ross, denial and acceptance and all that stuff. But denial is just something that we do. And instead of having a patient put up the defense mechanism of denial, we as nurses need to help them find different, perhaps more helpful or productive or constructive defense mechanisms, such as dealing with the problem or utilizing cognitive therapy or orienting the patient to reality in an effort to better help them cope. So I hope this video helped you better understand the defense mechanism in mental health nursing of denial, and we'll talk to you next time. Bye-bye.